is your station? Right, so if you have read and understood, considering it history-taking station, please begin.
Good evening. My name is Dr. Daniel Raza, and I'm a surgical doctor. I would like to confirm your name and age, please.
Good evening. I'm Mr. X. I'm 50 years old.
Pleasure to meet you. Today, I will be asking a
Thank
few
you.
questions regarding your health. Is that okay?
Yeah, sure. Go on.
So, what has brought you here today?
Like I have this um this pain in my chest for like a month ago.
All right. I'm so sorry to hear that. So, can you please exactly tell me, can you point out to that site where exactly is the pain?
Yeah, I think it's in the middle down there, like near my stomach, maybe.
All right. So, did it start suddenly or gradually?
I think it started like mm, it's increasing, I think. Yeah, it started suddenly like that, I think.
Okay, I'm so sorry about that. So, how would you
So
describe the
okay.
pain? Is it very sharp, burning, or tearing?
I think it's not sharp. I think it's like it's annoying like that.
Hmm. All right. So, does
I
it
cannot
stay here?
describe it exactly.
Okay. Okay.
Yeah.
So, does it stay here in your chest, or does it move to anywhere else?
It's all there. It's all the time. It's there. It's
Okay.
always there.
All right. So, is it any specific time in a day that the pain worsens?
I don't think so. I didn't notice that.
And what makes it worse, and what makes it better?
Nothing specific, as I can tell.
All right. So, on a scale of 1 to 10, considering 10 is the highest number, how would you rate the pain?
It's like maybe 5, 6.
So it must be very disturbing for you. So do
Yeah.
you have a cough?
No.
Okay. So do you have any shortness of breath or any difficulty in breathing?
Yeah, I think when the pain comes in,
Okay. So do you have any pain in your legs?
uh, no.
I see. So have you ever been evaluated in the past for your heart?
Uh, no.
And do you feel any difficulty in breathing when you lie flat?
No.
All right. So do you, how many pillows do you use when you lie down?
Just like one pillow.
All right. So do you wake up in the middle of your night with the gasping or with the gasping for the breath?
Um, no.
All right. So do you have any fever?
No.
Okay. So does the pain increases with the movement, with the posture change?
No. No.
Okay. So do you see your GP for any other medical conditions?
Yes, doctor. I think I've been taking this medication, warfarin, for
Okay.
some time now.
Okay, so and what dose are you taking of the warfarin?
I'm taking 5 milligram a day.
Okay, so any other medications or any other conditions?
Uh, I think he told me that I have COPD.
Okay, so have you ever been hospitalized before?
Yes, previously for this.
Okay, so any allergies to drugs or foods?
No,
So is there anyone in your family have been having the same complaint?
no, not as I remember.
Okay, do you mind if I ask you some personal questions?
Yeah, sure, go on.
What do you do for a living?
Yeah, I'm a driver
And whom do you live with?
with my partner.
Okay, so do you smoke currently?
Yes,
And how many packs per day?
1 pack.
Okay, have you considered it quitting?
Yeah, sometime, but because of the work and stress, and
Yes, I can
it
understand
comes
that.
back to I go
And
back to it.
all right, so do you drink alcohol?
Not much.
Okay, so what do you think the cause of this complaint is?
Um, I don't know. I don't know exactly.
Okay, and what are you most concerned about?
I'm afraid that it's my heart.
I can understand. So let's work together to find some management in this. And what are your expectations for us, from us?
I hope you can find out what's going on exactly, and this will not come back to me again.
Mhm.
Okay, good. Thank you.
Definitely,
Can you
definitely.
please summarize your history now?
Thank you.
Yes, I have taken history from a 50 years old gentleman who is a known case of COPD and
Yes.
has been taking warfarin for the previous episodes of pulmonary embolism. He presented to me with a complaint of chest pain that is there for around 1 month, and it is associated with a shortness of breath.
Yes.
And there is no history of cough or any painful leg since the onset of the disease.
All right. So
He
what are
has
your, yes, provisional and differential diagnosis for him?
Yes, my provisional diagnosis includes pulmonary embolism.
Yes.
Differential diagnosis could be a myocardial infarction,
Yes.
as the patient is obese, and the other differentials could be uh, pneumonia,
Yes.
and it could be musculoskeletal pain.
Very good. Okay. So what investigations would you ask for in order to confirm your diagnosis?
Yes, I would proceed with the complete blood count, uh, urea creatinine electrolyte, LFTs, clotting profile, D dimers, and troponin I. To evaluate for the myocardial infarctions. I would proceed for the ECG and chest X-ray
Yes.
and
And
go for the echocardiogram and
yes.
go for the radiological investigations that include the CT pulmonary angiogram to rule out the pulmonary embolism
Yes.
and
And ABGs.
the
Okay.
ABGs as well. Also.
What treatment can you offer to this patient?
Yes, after assessing the patient, if the patient is vitally stable, we can give him low molecular weight heparin or heparin. And if the patient is vitally unstable, we can proceed with the thrombolysis and embolectomy.
Right. And you'll be managing this patient according to which protocol?
Yes, I will be managing this protocol according to the care of critically ill surgical patient protocol
Yes.
and
Good.
manage this patient in the intensive therapy unit.
All right. Good. Thank you. Right. How would you, because your primary provisional diagnosis was pulmonary embolism, how would you decide which medication to give on the basis of pulmonary embolism? In other
Oh,
words, I want you to
yes, ma'am.
define what is massive pulmonary embolism and what is non-massive pulmonary embolism. What is the difference?
Yes, ma'am. In the massive pulmonary embolism, there will be a vitally unstable patient. The
Yes.
patient would be hypotensive,
Yes.
tachycardic, and basically in the obstructive shock. So
Yes.
in that case, we would need the thrombolysis or embolectomy.
Very good.
And when the patient, on the contrary, the other thing is non-massive, in which the patient
Yes.
is stable. So
Yes.
we can give him in the low molecular weight heparin and the warfarin for the next 6 months.
Yes, until
The
what would be the range of APTT?
yes, ma'am. The APTT should be in the in the range of 2 to 3.
Not INR, APTT in the seconds.
So
2 to 3 is you're
yes,
confusing
ma'am.
with the
The
INR
INR.
because
Yes, yes, yes.
patient was taking warfarin.
Warfarin.
Yes,
So this one is 50 to 60 seconds
50. Oh, sorry.
between. Yes.
Yes, I can't seem to
Good.
remember.
Yes. No, you are good. Thank you.